So gastroenteritis is kind of a big word, but I think like all big words, the best way to really understand it is by breaking it down. So gastro refers to stomach, enter refers to small intestine, and itis refers to inflammation. So there are really two different types of gastroenteritis. There's acute gastroenteritis, and there's chronic gastroenteritis. Acute gastroenteritis doesn't last very long. It's usually about a few days to a week. Chronic gastroenteritis, on the other hand, is persistent. It lasts for a pretty long period of time. We're going to mostly be talking about acute gastroenteritis. So when people have acute gastroenteritis, they don't usually say, like, I have acute gastroenteritis. They usually say something like, I have the stomach flu, or the stomach bug, or a stomach virus. So anyone who said they've had this is kind of familiar with some of the symptoms associated with it. So to look at those symptoms, why don't we actually look at the gastrointestinal tract over here. So here is the stomach, and here is the small intestine in green. So after you consume a meal, you'll have some stuff in your stomach that your digestive system is really trying to digest and then absorb. But when you have gastroenteritis, your digestive tract can't do that. So now you have all this stuff that your body is going to want to expel. So how is it going to do that? Well, it can either come out this way, right, through your esophagus, and that's really why, you experience some vomiting and nausea. It can also come out from the other end as well, right? And that's why a lot of people may experience some diarrhea. So there's a lot of nutrients and a lot of water that you've consumed, but your body isn't taking it. Now, because you're vomiting and excreting a lot of water out, you're not getting that water into your system. So you'll be pretty badly dehydrated as well. Some other symptoms could include things like abdominal pain and a fever. And usually in acute gastroenteritis, these symptoms last for about a few days to at most a week. So what's causing all of these symptoms to occur? What causes gastroenteritis? Well, sometimes people call it the stomach flu, and I think that can be a bit misleading. The ordinary flu is caused by the influenza virus. But this virus has absolutely nothing to do with gastroenteritis. There are a number of different infectious pathogens that can cause this instead. So you may have some different viruses or some different bacteria. So a few examples, right, some really common examples of the many different pathogens would be, like the rotavirus, the norovirus. So these are examples of viruses that could cause the disease.
This is the Emergency Medical Minute.
Okay, this will be quick. Probiotics for acute gastroenteritis. Concept really compelling. Under duress from illness or medications, the GI biome is altered, so we use probiotics to come to the rescue and kind of restore the natural balance. How does it work in real life? So a study, pretty well done study out of Canada for acute gastroenteritis in pediatrics showed really zero benefit for probiotics. So what they did is it was a randomized double-blind controlled trial, 886 pediatric patients in 6 Canadian emergency departments with acute gastroenteritis, acute diarrheal illness, less than 72 hours of duration. They randomized them to 5 days of probiotics or 5 days of placebo. In the end, 25% of each group went on to develop moderate to severe gastroenteritis, and the duration of symptoms in each group was exactly the same. So for acute pediatric gastroenteritis, no benefit. It doesn't mean that there's no benefit for anything else, but specifically in a pretty well done trial with good numbers, looks like it probably doesn't hurt, but most likely it doesn't help. So, quick.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners.
Every year, gastroenteritis accounts for 1.7 million visits to emergency departments by children in the United States. Probiotics represent an expanding industry with potential clinical benefits, but there are limited data supporting their use in this population. This multicenter randomized double-blind trial included 886 children between 3 and 48 months old who presented to the emergency department with acute intestinal infection, clinically diagnosed on the basis of 3 or more episodes of watery stools in a 24-hour period, and vomiting or diarrhea for less than 72 hours. The children were randomized to take by mouth 1 sachet of probiotic preparation containing Lactobacillus rhamnosus and Lactobacillus helveticus, or placebo twice daily for 5 days. The primary outcome was the occurrence of moderate to severe disease as defined by a modified Vesicari scale score of 9 or higher within 14 days. The proportion of children with moderate to severe disease was similar between groups. After adjustment for trial site, age, and pre-enrollment frequency of vomiting and diarrhea, the treatment assignment did not predict moderate to severe disease. The authors conclude that in children presenting to the emergency department with gastroenteritis, twice-daily administration of a Lactobacillus rhamnosus, Lactobacillus helveticus probiotic combination did not prevent the development of moderate to severe disease within 14 days. Full trial results are available at NEJM.